Well, hello everyone. Welcome to the May 6th meeting of the Rotary Club of Lancaster. I wanted to wish you all a very happy month of May and trust that you are all staying safe and hopefully keeping your sanity in the process. Personally, I spent my weekend with my boys, and with the weather being so nice, we were outside literally the entire weekend. We had a lot of fun. I hope you did as well. So at this time, I'd like to turn our meeting over to Jennifer Goldbach, who will be offering our invocation for today.
Good morning, President Jeremy and fellow Rotarians. I decided to choose for our invocation today a brief little Irish blessing that probably is very familiar to most of you. May the road rise up to meet you. May the wind be always at your back. May the sun shine warm upon your face and the rain fall soft upon your fields. And until we meet again, may God hold you in the palm of his hand.
Well, thank you, Jennifer. Moving on to joys and concerns. Fortunately, we did not have any concerns, which is great, but we do have a joy from Steve Trier. Steve's daughter was married in a drive-in wedding, and it was a wonderful success. The weather was terrific, and we certainly wish Steve and his daughter much congratulations. So that is terrific. So at this point, we're going to turn our meeting over to UPMC Pinnacle. The presentation is very timely as it is titled COVID-19 Lessons Learned, Current State, and Where We Are Going. Let's go ahead and get started.
All right. Okay, perfect. So I want to welcome everybody to our Northern Lancaster County Chamber of Commerce first virtual town hall, which is being presented by, in conjunction with UPMC Lidditz. And today we're really going to be providing an update on COVID-19 and its impacts throughout the community, how UPMC has been able to keep on the forefront of and overall care for the community in Northern Lancaster County, and also the strides they are taking to help us move forward with our recovery, both in the community at large and the business community in particular. We have some fantastic presenters with us today who are going to be giving a broad overview for the Northern Lancaster County region on where things stand. The first individual that I'm going to introduce is Brooks Turkle. He is the Senior Vice President of UPMC Pinnacle and President of the Lancaster region. We also have with us today Dr. Robert Contra, who is Vice President Medical Affairs for the Lancaster region. Dr. Michael Peck, who is Medical Director, Express Care and Occupational Health. Craig Skursensky, who is Doctor and Vice President of Emergency Medicine, and John DiLorenzo, who is the Associate Counsel. So I'm sure I butchered one of those names. I apologize. But at this point in time, I'm going to turn it over to Brooks. Brooks?
Liz, thank you so much, and thank you for those of you who have joined us. We're really thrilled to do this, and one of the great strengths of being part of UPMC is we are both local, we are regional. I said more than both. We're local, we're regional. We have a academic medical center presence centered in Pittsburgh, and of course we have our international work as well. So we've been uniquely prepared to be able to help meet the community's needs. And today, as you pointed out, we've got 3 physicians who are at the forefront of what we're doing here locally in central Pennsylvania. And so with that, we're going to let Dr. Skursensky talk a little bit about what's going on across the UPMC system and here in Lancaster County.
Okay, thank you, Brooks. Good afternoon, everybody. My name is Craig Skursensky. I am the Vice President for Emergency Medicine for UPMC in the central Pennsylvania area. With that, I have the opportunity to oversee all 7 of our emergency departments and have been working on our testing process. And it's a pleasure for me to be here today and talk about these things. Information is really important in this day and age. So the first thing we want to talk about is what is going on in our hospitals right now. And what you see on the slide there is that we have had 116 patients in our hospitals. These are inpatients who have been admitted who have tested positive. What you'll see there, though, is that this has had a relatively small impact on our overall volume capacity in our hospitals. The overall number of beds, the ICU beds, and everybody's heard about the ventilator use. And we have capacity with our ventilator use as well. So there's no question this virus has had an impact all across our region, but from our ability to maintain our operations and to deliver high quality care both to the patients with COVID as well as to other patients who are coming in with things we see all the time, such as heart attacks and strokes and other significant medical conditions, we have maintained our ability to deliver that care at a high level with safety to the patient as well as safety to our staff. We can go to the next slide.
Okay. All right, so our next slide is Brooks and Dr. Conter. Hold on one second.
Yeah, I'm unmuted. I think I should be good. So, and Bob, you should be unmuted as well. So, you know, we've been busier, if you will, here in Lancaster County than parts of other central Pennsylvania. But as Dr. Skrzyński pointed out, Craig pointed out, that we've been fortunate in terms of our capacities. This is the data from Lancaster County. And you can see one of the real challenges, and I'll let Dr. Conter speak to it, that there are clusters where the mortalities are particularly significant, both from a demographic perspective and from a location perspective. The other thing I will touch on before Bob talks about the disease itself, and that is knowing that we have a national challenge with respect to testing. We have, and Dr. Skrzyński is going to talk about in the next slide, but nationally we're only testing about 2% of the entire population. So a lot of the data is very challenging for the scientists in this, because we have flickers and flashes of information. It makes, for those of you who are paying attention in the newspaper or on television and whatnot, makes it exceptionally challenging to sort of filter through that. So it's part of the reason why we have these physicians and a lawyer on today to talk about what we do know. And so, Bob, you want to talk a little bit about what we do know about the disease, in particular here in Lancaster County?
Sure, Brooks. Well, UPMC, to the system's credit, has used several models in order to track the disease and its progression throughout the United States, and here particularly in Pennsylvania. A number of models were used. Some were based off Philadelphia models, but UPMC was primarily using a different model. It was based more on population density. And one of the things that we can see is, obviously, if you look at the chart there, the red is somewhat disturbing when you look at it, but that is where the highest population density is. So you're almost going to predict that you're going to have a larger number of cases in that relatively small area. And as you fan out to the surrounding areas in Lancaster, you're going to see less incidence of it. Part of that is due to the widespread population, and the rest is the fact that, you know, we still haven't tested everybody. And we're still in the process of doing that. We're catching up on that. But the population density is key, and that's due to the fact that the disease is spread primarily by droplet and by aerosolization. And we'll get into that a little bit more as the slides progress. And if anybody has any questions on that, please put them in the chat.
Thank you. All right, I will move to the next slide, if that's all right with yourselves, Brooks and Dr. Conter.
Yes, please. And actually, we're going to have Craig talk to this slide because he has been one of the leaders. We had a tremendous team that have set up our testing sites, and we'll credit where credit's due. We'll let Craig talk about testing sites since he's been instrumental in making that happen.
All right. Does Craig know he's doing that?
He does.
Yeah, sorry, I can't remember to unmute.
Okay.
So yeah, thank you, Brooks. It has really been a tremendous team effort, the inpatient care, and then specifically with this setting up of the specimen collection sites. Testing for COVID is not a simple process. We're hearing a lot about this in the media. It's a really hot button item for good reason. And setting up our ability to obtain these tests has been a group effort. So what we see here is the data on, these are outpatient collections, outpatient tests. And we have to be clear a little bit about how we selected these patients. First of all, these tests were all patients who had symptoms. We were looking for people who had a high likelihood of having the disease. So folks with fever and cough and runny nose, folks with difficulty breathing. Some of it was based on exposures, but it also was dependent upon the presence of symptoms. Also, we've had limitations with our capacity due to supplies and due to the availability of the testing sites. And so we have not been able to test everyone, even who has symptoms. And that's something we'll talk about. What's the coming attractions, if you will? What are the opportunities in the future? What you can see here is that we're seeing about a 13% positive rate for the patients that we've tested. This has actually decreased over the last week. We were seeing an increasing trend by week, where it started out around 9%, went up to a high of 19%, and now has dropped down over the last 7 days. So you hear a lot of these conversations about the data, what the data means, how we can interpret it, and there's some difficulty with that. But what we can say in our limited sample here is that our percent positive is trending downward, which is a good sign.
All right. So then I'll go to our next slide. And I believe that this slide is for Dr. Skrzynski.
Okay, so this is basically a list of a number of things that have been going on throughout the entirety of the UPMC system. There is a lot of concern in the healthcare community. There's a lot of concern in the community at large over what can we do to keep everyone safe. And a number of things that are listed here, including the establishing of the command centers and developing patient surge plans, all have to do with the uncertainty that this virus has brought to us. As we saw this moving around the world and into our country, we spent a lot of time getting ready for what could happen if we saw a large volume of patients with the disease, if we saw a large volume of people who were critically ill. We had to make sure we could keep our staff safe. And that's what we call personal protection equipment, or PPE. There's been a lot of planning and a lot of implementation of safe practices that met two needs, really. Our primary goal is to make sure our staff and our patients, and at one point our visitors, are safe coming into the hospitals. The second key skill is we have to have some sort of stewardship. We do not have unlimited supply of this PPE. And so we've had a lot of conversations about the various ways that we can be safe and prudent at the same time. One of those aspects was to limit the number of people who came into the hospital. We limited the number of visitors. We limited the number of patients, actually. They use the term on this slide, elective surgeries. The reality is a vast majority of surgeries are not elective for the patient. Patients don't go through surgery without some really good reason to do so, because there's always some risk. What we've tried to do is balance the risk of having the surgery versus the difficulty of the patient in not having the surgery. And for a period of time, the risk was such that we did not perform a number of those surgeries. What we've learned and what we're moving towards now is that we have the ability to perform procedures safely for our staff, for the patients, and the patient's needs need to be addressed medically. And so we'll talk again a little bit about how we do that. But for the early stages, we did decrease that. Telemedicine, we're going to talk a little bit more about telemedicine, but that has been the remarkable achievement of this time, is how do we provide care from a social distance? We're having this meeting today via a tele-platform. It's something that would have previously happened in a conference room or in a in-person environment, now being done virtually. We've done the same thing for medical visits. Both our primary care and our specialty visits have skyrocketed with telemedicine. And then we canceled the seminars. We've canceled group meetings. So what are we doing right now? We are continuing to limit the number of people that come into the hospital. We are doing a lot of monitoring and reporting of data. We do screening before anybody comes in, including our staff, and we're masking. Everybody is wearing a mask inside our building. this is an opportunity to educate. So we continue to have a number of these settings where we can get out in front of people, provide information, receive feedback, and answer questions that people have.
All right. I'm going to go to our next slide, which you are also commenting on, Doctor.
And this is sort of what I had mentioned earlier. This just shows the trajectory of increase of our telemedicine visits. And this is the same phenomenon that is happening all across the country with all different types of services. We're doing this. The Zooms, the Teams, all these virtual platforms have just really escalated in their usage. And we've been fortunate to have the ability to do that in medicine as well. We've been able to significantly increase our telehealth capacity, and you can see the numbers there. And we're doing this both on an inpatient level and on an outpatient level. So that's one of the big wins that we see, and we're excited to see how that translates into the future, where we can provide medical care virtually.
All right, Doctor, you're continuing on with this slide as well.
Okay, so UPMC, we've been, as Brooks mentioned earlier, we are very fortunate that we have local and regional care here, but that we are connected with an organization such as UPMC. And they are at the forefront of developing a number of capabilities that will help us to test, to gain information about how this virus works, how prevalent is it in our community, how many people who don't have symptoms have it. How can you tell? There's a lot of questions that come out of testing. And along with our other partners, UPMC is really leading the way on coming up with some of these. We don't have the full capability yet, but they're rapidly evolving.
Wonderful. Okay, so I believe that for this slide, it's either yourself, Doctor, or Dr. Peck who is going to be speaking on this, but I'm not sure where we stand with the ability to actually hear Dr. Peck.
All right, well, so I'll start going through this a little bit. And the relaunch is the top piece. And this is what I mentioned earlier. We really need to ensure that we can deliver the care that people need. That's really what we're looking for. And the point there is what they need. And there's a number of patients and a number of procedures who have been postponed. And it was appropriate to do so as we were learning about the virus, as we were getting ready for the surges, as we were making sure everyone was safe. And now, in a very prudent, cautious manner, we're looking at this again, and we're ensuring safety, we're ensuring high quality, but we're also making sure that we can deliver the care that people need. And that includes not just the procedures, but all, and again, we see the term elective on here. We try to stay away from the term elective. It really is essential. What we're looking at is what people need. People have been needing healthcare and these procedures for a long time, and it is current needs beyond the scope of COVID as well. We also are looking at reopening other services on the outpatient area. Some of that is imaging. Some of it is primary care. Some of it is specialty care. The next piece is testing. Testing really is the area where we have so much opportunity. And there's really two types of tests that I'm going to mention here. The first of which is what we're doing now, which is we're measuring we're getting a swab in your nose and the back of your throat, which looks for the presence of the virus. And so it looks for current presence of disease. Now, antibody testing is a blood test, and that actually looks at your body's response to a pathogen such as a virus. And antibody testing actually doesn't necessarily show the presence of disease. It shows that you've been exposed to it or that you've had it in the past. So we're still learning about how both of these tests work for this particular virus. We have a lot of experience with antibody testing in other diseases. It's often how we measure immunity after vaccines. When we've developed vaccines for a number of different things, you can measure the antibody response that your body produces, and it gives a suggestion that you now have immunity from the presence of the vaccine. In this arena, we don't have a vaccine yet. So all we're really measuring is people's response to the body having been exposed to the virus. And what that means and the asymptomatic approach to that, what the prevalence in our society is still yet to be determined. So those are the two really big areas of testing that we're looking for. You know, the clinical trials. Medicine is science-based. And there's a process, there's a scientific process that medicine goes through. And it involves all the aspects that we're seeing now with this virus. The first of which is identifying symptoms. What are the components? How does this manifest itself? It goes into diagnosis. How do we make the diagnosis of this disease from the testing we talked about to other type of imaging such as x-rays or CAT scans to how people do under certain treatments? That leads to the next statement, which is treatment. How do we come up with methods, both medicinal, how do we get medicines for this, but also what are some of the supportive efforts that we do with ventilators, with other types of assistance with getting oxygen into the body. And then the final piece is continuing the community education. How do we adjust to the new normal that has COVID in it? We have adjusted to the new normal of a number of other diseases which came about, and we learned how to manage them. We're going to have to figure that out with this one as well. The phrase we have here at the bottom really talks about making sure that there's communication between patients and their healthcare providers. And what we want to do is what's necessary, what's essential, in the absolute safest manner for the patient, in the safest manner for the healthcare providers and facilities.
Great, thank you. This is Brooks. I want to highlight a couple things that Craig said, and also ask Dr. Conter to talk about something specific locally. I think exceptionally important to understand, Craig stressed the science, and I alluded to that in our connection to University of Pittsburgh and UPMC, in that we are very, very science-based on this. And what you'll hear from us and our physicians is we are using that which we know works. And I think one of the bigger challenges, as an employer and here in the community and thinking about what we need to do for our employees, which we'll talk about in these coming slides, one of the challenges is there's testing out there that may or may not give you what you're actually looking for in the test. That's why we're still working on the antibody testing and rolling it out. That's why the uncomfortable tests that we're doing on patients, the so-called nasopharyngeal swab, we are doing because it works, and we're very, very concerned about offering those things that may or may not work. And I think as an employer and as a citizen, that's one of the harder parts to filter through, and that's where our medical professionals really come into play to help guide. We'll talk a little bit about the employer perspective here in another slide or so, but in the meantime, very quickly, Dr. Conter, you want to talk a little bit how the triad works and how we then are delivering on the relaunch and reopening services in a very safe way?
Sure, I'd be happy to, Brooks. Brooks mentioned the surgical triad, and that consists of our chief of anesthesia, chief of surgery, myself, who is also co-chair of the Department of Surgery, and the vice president for medical affairs, and our operating room chief administrator, Christy. We meet every day to look at all of the operative cases that are scheduled for the hospital, and keeping in mind that we have never denied any emergent or urgent care, and we never will under these circumstances. We will do whatever we can to protect patients and staff under those circumstances. But we're now moving, as Craig mentioned earlier, to essential care for our patients, and we're asking our surgeons to take a look at all their backlog of cases. I personally have probably 25 cases that I will need to get scheduled sometime in the future for surgery. So I've gone through and prioritized those as to which are the most important. For example, a patient who's had long-standing abdominal pain for many, many, many months but is able to tolerate it will be prioritized over somebody who has a small soft tissue mass on their back that they've had for 4 years that want to get rid of. So we're in the process of prioritizing all those cases, looking for the most essential treatments that we can offer our patients. In addition, we want to do this in a safe environment, and this is where Craig's team and everybody gets a lot of credit. When we set up our preoperative screening, we're doing it downtown at the Imaging Center of Lancaster. And that area has been set up with 2 negative pressure rooms to help protect not only staff, but patients when they come in. So they go into a negative pressure environment, they get their test, and they exit out a completely different site from the facility. So we're protecting our patients during testing, in the testing environment, and outside as well. Now keep that in mind, and Craig can certainly talk to the testing process better than I can, but just because we test you on, say, May 1st, doesn't mean you won't have a viral load on May 5th. So that's the testing things that we have to do. We're testing on that moment for the viral load. If you're negative, great. If you're positive, then we go on to other things and recommend the quarantine for 14 days. We do have a separate site for testing in Lancaster down at the Stadium, which we work remarkably well with our colleagues at Penn Medicine, and Brooks can speak to that. We're using that mostly for our symptomatic patients. So we're trying to separate the patient populations, again, for community safety.
Thanks, Bob. And within the hospital, same thing. So patients who have been had COVID or suspected of COVID in the hospital, we have kept in these negative pressure rooms, which then pushes the air to the outside rather than recirculating in the hospital. We have kept them to our second floor, either in the intensive care unit or in the acute care medical unit. And as we bring patients in for surgery, we'll be bringing them into our third floor surgical area, which we've kept closed throughout this process. The hospitals are cleaned and sanitized, and hard surfaces are being sanitized. So we're doing all of these things consistently about making it sure it's safe for the patients. You know, one of the harder things is the visitor restrictions, because visitors are helpful. We've deployed a significant number of technology pieces, including iPads, to help people communicate when they're in the hospital if they don't have folks with them. And so we have made some minor modifications around the essential services in terms of being able to have folks come in and help people get settled pre and post surgery, but really focusing on what we all should be doing is that social distancing, masking, and protecting each other, because we don't know who has the disease. And so with that one, we go to the next slide and talk about the future for employers.
Okay, could we just check and see? We were trying to see if we can get Dr. Peck online. Dr. Peck, can you see if your audio is working as of yet?
Yeah, how does this work? Do you hear me?
Yes!
Perfect.
Wonderful.
You know, it's always appropriate,
Great.
Dr. Peck, the cavalry needs to arrive just at the right time. You know,
I made it. No time to spare.
Fashionably late is always great. All right, so we'll move to the next slide. One moment, please, gentlemen. Of course, now my slides won't work. There we go. Please continue.
Okay, this is a very interesting slide. It's we're talking about when what Brooks and everyone was talking about were patients. Whenever I get a call from people, it's what do I do with my employees? How do I get my employees back to work? What do I need to do? And if you look at the color coding from Dr. Wolf's office, when they're starting to roll out who gets to reopen, the big question I'm getting is how do we reopen? What do we need to do? What do we need to look at? And really, the hard part of this, that from an employer standpoint, it depends on hospitals and healthcare systems. I'm not saying the pathway is clear, but it's more clear to how do I handle this than if we're coming from, say, the trucking industry and I get the call of how do we handle disinfecting our trucks for over-the-road drivers that have to switch drivers? How do we handle the truck stops? How do we handle refueling versus a poultry processing plant versus the employees at a nursing home facility? So all of those really are looking at such a diverse approach to how do we keep all of those people safe as we bring them back online, as from an employer standpoint and from a healthcare standpoint. And we've been working with long-term care facilities to help them. And really all I can say to that is if you can call us and we can help you with a specific question for your company, because everything has to be tailored to the layout of your factory or your trucking company. So there's a lot of different issues that we have to talk about, but they're so specific to the employer that there's not a one-size-fits-all. And to the point of testing, we get a lot of questions on the testing, and I think that was covered very well as far as what do we need to have testing in the future. We really aren't 100% sure yet. So I think the important take-home message is don't be afraid to say if you're not feeling well to your employer, but really from the employer standpoint or for the long-term nursing care facility, call us and we can help you. That's really from my standpoint where we have to stand with the employers. And on the slides, you'll see my contact, Glenda Doherty's contact. Please don't hesitate to call us with any questions you have, and we'll help any way we can.
And we as a chamber can share that out to all of the attendees on this call as well. So if you're participating, we will have that available to be emailed out to you. And if anyone does need that, they can also reach out to the Chamber of Commerce. All right, if we are done with this slide then, Dr. Peck, I'm gonna go to the next one. All right, and my understanding is that John DiLorenzo is going to be speaking on this one.
Yes, finally you get to the lawyer. That's great. So thank you, everyone. Good morning. There's a lot of reasons why I like doing these. We did one last week, and I got to announce, because unlike my colleagues, I don't take care of patients as an attorney. You never want that to happen. So I don't get to go into the office all that often. So it's a treat for me to, number one, put on a collared shirt, and secondly, to actually shave in the last few weeks. So I thank you for that. I announced the last one we did last week that it was the first time in at least 2 weeks I got to do both of those things. What I didn't announce was I was still in my sweatpants. I decided that I was going to put on dress pants today, but I didn't put on shoes and socks yet. So maybe next one I'll do that too. But with that said, I'm going to handle this slide. I am not going to go necessarily in any particular order, but I will cover everything that's on the slide. So the first thing is this whole idea of privacy and HIPAA, because this comes up from time to time when people are asking for information. So HIPAA is the Health Insurance Portability Act. That's the law that went into place that provided that covered entities, i.e. healthcare providers and their business associates, couldn't share medical information regarding a patient with anybody except if an exception applied or the patient consented to the release. So when they instituted HIPAA, there is an exception in HIPAA for infectious diseases and emergency situations. As you can imagine, it makes sense. So what the Office of Civil Rights, OCR, is the office within the Department of Justice that actually enforces HIPAA. And what OCR did when the pandemic started was they issued a bunch of announcements. And all those announcements, by the way, can be found on the hhs.gov website that's listed below. And they said they're exercising their enforcement discretion, and they allowed healthcare providers to release certain information about COVID-19. And first, as you can imagine, was they said you can issue information to health enforcement agencies, health authorities, both local, state, and also federal government. So those were the first ways that HIPAA was impacted. Later, they came out and said you can also talk to police and first responders when they're responding to patients if you know they're COVID-19 positive. And then lastly, they issued a guidance that said you can give information to families who are providing care for COVID patients. Once again, in trying to keep people safe. However, as of today, they still have not said anything about issuing information to employers. And I'll explain to you what that means and how they're handling that issue. But as of right now, us as the covered entity can't go out directly to employers and say, one of your employees tested positive. So the beauty of doing this is it has allowed sharing of information. It also relaxed requirements that has helped us do the telemedicine, which has been phenomenal for us and other healthcare systems. So it was a very positive thing that they relaxed some of these restrictions. So what are we doing then? So when a person is testing, either the lab or us, depending on how this is all getting tested, someone is reporting to the state this information about the positive tests. And the reason they wanted to do this makes sense, and that's got to do with the contact tracing, or it's also called contact indexing, whatever. This allows the state to try to figure out who was exposed. Now, unfortunately, this process really didn't take off until last week. Finally, the Secretary of the Department of Health, Rachel Levine, issued guidance as to how this contact tracing was going to take place. And they're focusing it all on the public health nurses that are working for the Department of Health. Here's the unfortunate part, though. There's only 131 of them in the entire state. There's over 40,000 cases of positive. You can imagine it's going to take quite some time. Now, I was talking to my friends at the Department of Health, and they told me that each one of these calls that they're making, these people, is taking in people doing it, how long this is going to take. They don't have a priority right now, although they're trying to work on a priority system as how they go about doing it. But nonetheless, they are working on a plan and they're trying to do it. It's just going to take some time. And of course, there's discussion about hiring more people because there's a lot of unemployed people. Can you bring them in? Can they make these calls? Can they be trained? All those things are going on. But as of right now, there's only 131 public health nurses doing this contact tracing. When they do, and I actually saw part of the script, not the whole script, they do ask the employees or the people who have tested positive whether or not they have been working and where they're working and all those other type of questions you would think are relevant. However, as of right now, those nurses are not contacting employers. What they're doing is they're telling people who have been working that they should contact their employer and give them information that they should share. But they don't require it, which is where you come in as employers. So the first thing you want to do, if you want to get this information, is you need to look at your policies. You need to look at rules for your specific industry. You need to look at your contracts. Because if you're, let's say, have a collective bargain agreement, there might be items in that where don't allow you to ask these questions or have to ask them in a specific way and so forth and so on. So all that's going to be really specific for you and your industry. Your policies are really very, very, very important here. That's your number one thing that you want to look at. Because if you have a policy that says people have to report this, you have to be careful. Because you can't be discriminating, because the ADA still applies, the Americans with Disabilities Act. You can't be discriminating because of this. You have to be doing it for a worthwhile purpose, and if you're doing it to just protect other workers, that's fine. But you need to be real specific on what you're going to do with the information, how you're going to handle it. All these things come into play. So I would strongly, strongly advise you to look at your policies, and then if you have to, talk to, like Dr. Peck said, you can talk to other experts in the field on what's the best way to handle these things, and specifically your employment attorneys. Have those discussions so that you're making sure that you're not violating any other rules or contracts or whatever that's out there that might apply to those situations. So there was a question about workers' compensation and whether or not a person who tests positive can claim workers' compensation. As I indicated in the bottom of that slide, the state did put out a bulletin on this very issue at uc.pa.gov. And it is indicating that it will recognize for workers' compensation purposes that if a person gets COVID-19, that they can trace it back to the employer. And how they're going to do that, I have no idea, but it's going to take some time and some effort. But someone's going to look at this, and it may be an injury that is compensable under workers' compensation. So that is going to be an ongoing issue as time goes on, as they look at each one of these cases, as people file claims for workers' compensation and how that process is going to pan out. You can imagine it's going to evolve over time, and you need to be aware of it. If there is a indication that a person obtained the disease through their work contact, certainly all those medical expenses associated with the COVID-19 will be covered under workers' comp, and there might be other recovery that a employee can get depending on the situation. There are really good materials out there from the state on this, so I would strongly suggest that you look at those websites that talk about this so you can understand how the process is going to work. Also, when you're dealing with COVID-19, we're doing a lot of testing. We're doing it in public spaces. We're doing checks and things. All those HIPAA rules have been relaxed to some degree. We do take reasonable precautions to make sure that the information doesn't get out, but it is not as strict as it has been in the past because of the situation and having to deal with the more public display of the symptoms and so forth and so on. So we have relaxed them to some degree, but they're still in place, and we're trying to do the best that we possibly can. Does health insurance cover COVID-19? The answer to that question is it depends. Once again, it depends. It depends on your insurance. So what happened when this all started was the insurance commissioner for the state of Pennsylvania issued a mandate. And it was a retroactive mandate, which, by the way, people question as to whether or not that was actually enforceable. But what happened was this mandate goes out and says, you insurance companies, if you are regulated by the state of Pennsylvania, you must cover the testing, the costs, and so forth and so on. The vast majority of the insurance companies didn't fight that, even though they may have had an issue as to retroactability of the mandate, but they're covering it without question. Now, those are only for insurance that's regulated by the state. If it's an ERISA plan, that is not regulated by the state. So it's up to the federal government. What has happened in the vast majority of these cases, if they are ACA compliant, which is the Affordable Care Act, all these costs would have been covered regardless, because that's just the way those plans were designed. However, if you have a plan that is not ACA compliant, it is very possible some of these costs, if not all of them, may not be covered. In insurance, you get what you pay for. So you really have to look at those non-ACA compliant plans to determine whether or not there is coverage. I'm sure a lot of these insurance companies are going to be looking at it very closely and making some decisions as to whether or not they're going to cover it. But nonetheless, it all depends on what the plan says. But the good news is regulated health insurance in the state of Pennsylvania, it's covered. ACA compliant plans, it's covered. So another really interesting question, and this is going to plan out over time, is let's say one of your employees tests positive. Is the employer liable? And that's a great question that nobody knows the answer to. I can tell you, I've been doing a lot of research on this. There have been some very large suits. One against Walmart has been filed on an employee that died, and they're saying that the employee got sick at work. There is going to be a whole host of these types of lawsuits that pop up. It's going to be interesting how they all play out. Once again, you're going to have to prove, and like you do in any other negligence type of suit, that there was a direct causation. And is it going to be possible for them to say, yes, I caught it at work, and it was because the workplace didn't provide the things that it needs to provide? Which gets you to a real interesting question, and that is, what are you supposed to provide? And, there really isn't a whole lot of guidance out there. The one law that like universal that applies in this situation is the Occupational Safety and Health Act, OSHA. And under OSHA, employers are required to furnish each employee with a place of employment which is free from recognizable hazards that are causing or are likely to cause death or serious physical harm. So that's the overriding standard. And OSHA has not said anything other than follow the CDC. They haven't issued anything, although there's a lot of movement to make them issue something or to enforce something that they can enforce. But as of right now, there's nothing more than what you're seeing in the CDC guidelines. So that goes back to what I said before. You need to consult experts, you need to talk to people, and you need to evaluate your workplace. And then you need to compare that with what the CDC is putting out in guidance. And for all the guidance that's put out there, you must follow it. And that's going to be hard in certain situations because they're non-specific guidance, but you really need to evaluate your workplace and try or attempt to adhere to the guidance that's being put out by the CDC right now, and hopefully from OSHA in the future, that you will be able to say, and point to, I did all the things that I was required to do to make my workplace safe. And if that were to occur, then you would have a defense. Now, there is a push, a very strong push from the U.S. Chamber of Commerce to try to get Congress to institute some immunity legislation over this COVID-19. That has not moved at all at the present, but there is talk and a lot of lobbying that's going on the national level and somewhat from the state level to provide this immunity. So we'll see how that goes. As in many things in the law, it evolves slow, and hopefully we'll get some decisions out of the feds and the state on this issue. So that's all I have on this slide. I certainly will answer any questions later on. So I'll turn it back to you, Liz, to go to the next slide and get the next presenter.
All right, great. Looks like Brooks is going to be up again for our next slide. Hold on one second.
Yep, and the good news is we're almost done. And so this is the gratitude slide, if you will. And so this slide talks about how you can give us things, which is nice. But let me speak to the tremendous gratitude from all of us in UPMC in the Lancaster region of what we have, of the outpouring that we've seen from businesses, from our volunteers, from fire and EMS. And it makes a huge difference every day. And so I can't thank you enough for that overwhelming support that we've received, as have our colleagues in Ephrata and our colleagues at Lancaster General. It is absolutely remarkable. The team comes in every day. They do a hard job. They've done a hard job exceptionally well. I'm thrilled that as part of the UPMC that our supply chain was way ahead of this. So we were able to prudently, as Dr. Skrasinski said, but manage the availability of protective equipment for our staff. We are initially, by the way, we were not accepting cloth mask donations, and the reason that we did not is we were committed to only the commercial grade materials that we would then make available to staff and to patients. Now that the governor has requested that everyone wear, or ordered that everyone wear cloth masks. By the way, all of us are in a single room with nobody else in here, which is why we don't have masks. But I can tell you that if Dr. Conter were in this room with me, he and I both would have our masks on. Yes, they're not far behind, and so wear the masks. We know that as Dr. Conter pointed out, that we believe this is droplet precaution or droplet transmitted. We know that if I wear a cloth mask and you wear a cloth mask, together we've dramatically improved the safety of our interactions and staying 6 feet apart. But let me back to the thank yous. Just thank you to the entire community. Thank you to the business community. One of actually Craig's providers in the emergency department suggested that COVID calories don't count. And I think we've all gained at least 5 pounds thanks to many of the treats that we've gotten from the community. So we have evidence to show for it. So with that, we'll move on to Dr. Conter and Dr. Skrasinski to talk about COVID-19 myths.
All right, gentlemen.
Greg, you want me to take the first one? I'll go ahead and take the first one.
Sure, yeah, go ahead.
Social distancing isn't effective in preventing the spread of COVID-19. Social distancing is absolutely effective in preventing the spread. And let me give you an example of that. When my son was young, he would never cover his mouth when he coughed or sneezed. And he thought it was great fun chasing his sisters around the house, trying to spray his contamination around them. But after I finally cornered him and got him on the couch, I said, you're spreading germs. Germs to a 2-year-old mean absolutely nothing. So I got a hand mirror, and the next time he coughed and sneezed, he sneezed actually into the mirror. And we see 2 things, other than a mess besides that, but we see 2 things. The first is the mirror fogs up. And that fogging up is actually the aerosolization that we talk about. The next thing is there's a lot of moisture on it. Those are the droplets. So once he saw that, he kind of got an idea finally what germs are. So that's how this disease is spread, by the aerosol component and the droplets. And then we did a little science experiment, because what he did then was actually start coughing and sneezing on every mirror in the house, which frustrated my wife to no end. And then we started doing a science experiment and moving him farther back away from the mirror. And interestingly enough, it didn't fog up and fewer droplets came on the mirror. So we proved that way back when. So social distancing absolutely works and is very important in this. Craig, I'm going to do the next one too, because Brooks has already alluded to it. Masks are not effective in preventing the spread. Well, that is not true. There is recent data that comes out that says wearing a mask will prevent at least 95% of droplet spread and will prevent at least 65% of aerosolization. The reason the aerosolization is less is what most people don't know is these viral particles are very small. So if you just take a look at your hand or your arm or your hair, that's literally about 500 times larger than a viral particle from COVID-19. So the mask that we wear now, you will get some aerosolization out of it. But remember, this diffuses out into the open air environment. So your actual exposure is going to be much less. Think of it as a drop of food coloring in a bowl of water. Once that concentrated drop hits the water, it disperses rapidly so that you almost don't even notice it or know that it's there. So those are the best things I can tell you, but you definitely need to socially distance, and a mask is absolutely essential. I mean, think if you're at the food store and you see somebody coughing on the apples, you're going to go down another aisle and get a can of applesauce. Greg, I'll let you go with the next one.
Yeah, so I just want to add one thing onto that, and that is that hand washing and hand hygiene is essential as well. One of the most common ways that this actually spreads, in addition to what Dr. Conter mentioned, is people touch their hands and then they have it on their hands and they touch other things. So the one thing to be cautious of with the mask is you tend to touch your face more, and so hand hygiene is absolutely essential. And that includes washing frequency. It also includes the alcohol-based hand sanitizers. That is one of the, in addition to the two things that were mentioned before, it's essential that we do hand hygiene to prevent spread. And that's something that has always been a good idea, but now more than ever is something that we should continue to look at.
Yeah, Craig, let me tie on to that, because in the world of surgery, we usually think that the sterile areas from the waist to the neck. Now we're thinking much higher, from the neck higher, that we don't want to touch anything from the neck higher up. So thanks for bringing that up.
Yep. All right, the next one is only older people are at risk of serious health problems, and that also is a myth. That is false. We do know that older people are at a higher risk, and we have seen fairly significant disease in the older population, but we're also seeing folks that are in the younger range, in the 20 to 49 range, that do become seriously ill. One of the challenges that we have moving forward, one of the opportunities for the science to kick in, is to try to determine what it is about the individual or the viral load or the exposure that causes such a difference in the response amongst different people. There are folks who have very mild or even no symptoms, and others who obviously have very severe and critical illness. So we do know that there are risk factors, and age is one. There's a number of other ones that are continuing to be spread, but we should be aware that really everyone is at risk of having infection, and with that comes the potential for serious symptoms.
So then the next one is the vaccine.
So the vaccine, there is not currently a vaccine. This is what everyone is looking for. The way vaccines work is that you expose individuals to some component of a bacteria or virus that then causes their body to create the response, which then has them be immune to the disease. Obviously, it is very important to do this safely. It is important that the vaccine trials are used. So first of all, that it's very safe, that we're not actually causing disease in people. And then the second piece is it effective? So both safety and efficacy are necessary when studying a vaccine, and all of that takes time. And so speeding up a vaccine sounds good, and the faster we get it, the better. But it's essential that the vaccine is both safe and effective once it's made widespread available.
Next one is, there is a treatment for COVID-19.
Well, this is also something that is the subject of much conjecture. And the reality is we don't know what the treatments are right now. There are myriad trials being undertaken right now to look at a number of different approaches. And this varies from medications, as I mentioned earlier, but also supportive care, different types of oxygen delivery, whether ventilation on a ventilator is necessary, how to deliver oxygen up to prior to going on a ventilator. So right now, we do not have a known effective treatment. There are a number of medications who are showing some early promise, but nothing that has been proven definitively.
Craig, let me just add one other thing. Recently, we've heard on the news about the possibility of using cleaning solutions, either to ingest or otherwise use. Please, please, please do not do anything of that sort whatsoever. We don't want to see that. That's absolutely wrong and false. And I just wanted to bring that out there so that the public is again aware.
Yeah, there was actually, in addition to that, there was a recent study that showed one of these sort of really odd attempts at treatment with a substance that was toxic actually caused hundreds of deaths. So absolutely, we need to get our science from our scientists and get our treatment from our physicians. I think it's a time where there's so much information overload coming at us, and at times we're all learning about the same things on the news or on the internet. But yeah, absolutely, stay away from these sort of one-offs and don't ingest the cleaners.
The final myth that you guys have here is that if you've had COVID-19, that you cannot get it again.
Yeah, and that's where these antibody testing approach comes in. So again, once you've had the virus and you have antibodies present, number one, we've seen a wide range in the levels of the antibodies in people who have been positive and have had symptoms. And then the second piece is, does that presence of the antibodies do what we call confer immunity? In other words, does it make it so you can't have the virus again? And the answer is we don't know. That is yet another question that we're hoping that science can answer for us as quickly as possible. There obviously are some infections where you get them once and you don't get them again. The most famous is probably chickenpox. But influenza, for example, if you get a different strain from year to year, you can actually get that again. So where this virus falls in that spectrum, we're yet to have determined.
And that's one of the things we're worried about, is that we know that the virus can mutate. There's been at least 3 recognized different subgroups of the virus so far. Hopefully, if it will keep replicating, it'll replicate itself out of existence, which is what we hope as well.
All right. So we do have some questions that were submitted through the chat. So I'm going to pull those up and I will read those out. And unless they specifically ask for a specific doctor to comment, I'll have any of you chime in. But Dr. Conter, I did have an individual who asked if you could please repeat the statistics of reduced aerosolization and droplet spread with masks.
Sure. With droplet spread, wearing a mask will decrease the risk of droplet spread by 95% and aerosolization by 65%.
Wonderful. And then you can also probably speak, well, you may not be able to speak towards this one. If a person tests positive and has mild symptoms, how do they know when they are well? And if tested again, will it be positive?
The disease is going to have to run its course. And keep in mind that at least 80% of people will have a very mild form of COVID infection. They may have the sniffles, a mild temperature. Some may have a slight cough. We look for as clinicians as disease progression. So if patients are now feeling that they're getting worse or manifesting more symptoms such as diarrhea or a sore throat or now getting shortness of breath, it's time to get away from home. It's time to get to see the doctor or into the emergency room. So it's following the progression of the disease. Most of this is short-lived. In fact, if you're going to develop symptoms, you should develop them within about 4 to 5 days, and then they should gradually subside. But if they persist, then's the time to act.
And I just want to add, looking at our outpatient testing data, remember, these are patients, all of whom had a physician encounter. Their physician referred them for testing. All of them had symptoms that would have been consistent with a COVID infection. And right now, only about 13% of our tests are coming back positive, which means 87% do not have COVID as the source of their symptoms. So it's important to remember that not all of these symptoms are, and actually a small minority of them are coming from COVID. And again, as Dr. Connor mentioned, a significant majority of patients, even who end up testing positive, have very mild symptoms that resolve on their own. And so,
Liz, I'm sorry, Greg. I stepped on you. I apologize. So Liz, we a little plug here for, and we'll make sure you have the information for your website, but for our nurse advice line, because again, if folks don't know, we've got a 24/7 nurse advice line, and then if you don't have a primary care physician, they can help connect from primary care. And then, as we've talked about, we have these virtual visits available now. So if you're feeling poorly, being able to talk to somebody on the phone, being able to do a virtual visit prevents you from actually having to go into an old-fashioned waiting room or a emergency department. So the phone number for the nurse advice line is 717-988-0074.
All right, I will definitely share that out. Our next question, I think, is almost a combination of a response possibly from the doctors, but then also most definitely from John. If an employee reports that they have been exposed to someone who has tested positive for COVID-19, and that person has worked among other employees, what is the best practice for us to proceed? So I would say, from a medical standpoint, what would be a recommendation for that? But then for John, if you could comment on that. We'll start from the medical standpoint. If one of our doctors wants to just weigh in on that, please.
So these are recommendations that are continually evolving, and we're getting our guidance from the CDC on this. So if I understand the question, if the employee gets exposed to someone and then others are exposed to the employee, but the employee is still asymptomatic.
Correct. So what the employee had said, my uncle tested positive for COVID-19, I've been around him. So they're letting the employer know,
Right.
but they don't have any symptoms. So what's the best policy there?
And the others, so everyone else who worked with that individual is not considered to be exposed.
Well, right. I believe so, yes.
The individual themselves, if they have direct exposure to someone with a documented positive infection, then they should consult their employee health or their primary care physician. Typically, we would be looking at a self-monitoring and quarantining approach there because of the direct exposure until such time as that patient either develops symptoms or runs its course. But the remainder of people are not considered exposed in that scenario.
John, did you want to weigh in from a legal standpoint at all?
Absolutely. So once again, I go back to what I said before. You might be imposing temporary rules within your employment facility to deal with these type of issues. Start with the premise that all your rules need to be tailored to protect the health and safety of your employees and work backwards from there. So you're following what the medical experts are telling you, what the CDC is telling you, and you're implementing your policies based on those guidelines and working back as to how you're going to adhere to those guidelines in your particular industry. So if you're in an industry where everybody's close contacted, you might have to answer that question differently from somebody who has, a lot of space between employees and maybe a little bit of interaction between the employees. You really need to assess your industry, your employment situation, and adhere to your policies as best as you can, with the ultimate goal with trying to keep everybody safe. And if you follow those guidelines, you'll be fine.
Okay. We have a few more questions. Won't take too much longer. I did have someone who did want to thank all of the presenters for their work and service to the community They very much appreciate it. They were looking to see if you would be able to provide any information on how COVID-19 is affecting children, and also if there is any kind of timeline estimate when antibody testing will be available and how you're anticipating people will be able to access that. This one's not directed at John, so one of the doctors has to pick this up.
Yeah, so again, as we mentioned earlier, there's no one age group that is completely outside of risk. Everyone does have some risk. It has been interesting to see that the percentage of infections in children is very low. And I'm always cautious using this data because the number of children that we're testing is very low. And so we don't necessarily know what the prevalence of the disease is in the community. What we can say is we're not getting sick kids in the hospital. We do not have a significant number of our inpatients, even at our hospital here, but even at our sister hospital in Pittsburgh, which is a children's hospital. They have not seen a significant number of children who have significant infection. We have seen anecdotes locally. There are a few that we have had positive locally, but not anywhere near the level of the other age groups. I do not have a scientific answer to the why of that. Certainly, children get every other virus, so it would be expected that children could get this as well. And then the second half of the question was the antibody testing, and this is a little bit harder to explain. But the time factor on this is when will the test be done accurately? And then we have to figure out, once we have the accurate test, how do we apply it? What does that mean? And so I think we're still probably a few weeks away at least from having a significant antibody test capability locally. How that rolls out is still being worked on.
All right, well, that is the extent of our questions for the day. And it is after 11 o'clock, and I know that you gentlemen are exceedingly busy. So I want to thank you for participating and for hosting this town hall today. I feel that it definitely was extremely imperative to get the information out that you have, and also to be able to give our chamber members and the community at large an opportunity to ask their questions. We really appreciate everything that UPMC has been staying on the forefront of here in Northern Lancaster County and throughout the state of Pennsylvania. I want to thank you for your time. I want to thank everyone who participated today through our town hall. This is the first of many that we are hoping to be able to conduct for Northern Lancaster County. You can keep track on our website and also our Facebook page for more information. So gentlemen, thank you very much for your time and for your information. And we hope that you stay safe and are able to come forward with hopefully the antibody testing and also a cure very soon for COVID-19. Thank you very much, gentlemen.
Liz, thank you so much. And as we close all of our safety huddles, wash your hands.
Thank you very much, Brooks. Everyone have a great day, and we look forward to seeing you sometime soon.
Thank you.
Take care.
Thank you. Bye-bye.
Bye.
Well, thank you very much. Very well presented and, of course, very timely. In closing, I hope that you all have a safe and productive week. And remember, even though many of us are isolated, I would encourage you to continue to live as Rotarians. Folks, until we meet again, stay safe.